Hello, I'm Dr. Rick Fowl, and this is a Society for Vascular Surgery briefing about the early history of vascular surgery. One of the earliest treatments for people with vascular disorders was described by the Greek surgeon Antyllus, who lived in Rome in the 2nd century. He first described proximal and distal ligation for the treatment of aneurysms, followed by evacuation of the contents within the sac. This technique remained as the standard procedure for aneurysms until the 19th century. In the 16th century, Pare introduced ligature of the arteries instead of cauterization with boiling oil during amputation. He was the first to characterize and document the phenomenon of phantom limb pain while working as a battlefield surgeon in the French army. He believed that the phantom limb pain occurred in the brain and not in the remnant of the limb. This is still the consensus opinion in the medical community to this day. In the 18th century, the British Army surgeon John Hunter advocated ligation of aneurysms at a distance well proximal to the aneurysm. For popliteal aneurysms, he placed a ligature within a fascial tunnel of the thigh that is now known as Hunter's Canal. He was also an excellent anatomist and described the role of the lymphatic system, which was one of the great mysteries of that era. In the late 19th century, Nikolai Eck created one of the first anastomoses between two vessels when he sutured the portal vein to the inferior vena cava. This became the foundation for the surgical treatment of portal hypertension. In the early 20th century, the French surgeon Alexis Carrel described the basic techniques that laid the foundation for modern vascular surgery. Carrel developed and perfected the technique of suturing blood vessels and also organ transplantation. Most vascular surgeons today still use the Carrel patch for implanting an artery onto another artery or a prosthetic graft. For his pioneering work in this field, he was awarded the 1912 Nobel Prize in Physiology and Medicine. Although these early contributions seem trivial compared to what we know and can do today, all vascular surgeons owe a great deal to these early pioneers who created and developed our specialty. To learn more about vascular health, visit vascularweb.org.